Dr. Hellings, how can digital help in implementing integrated care pathways?
Well, it's very clear that the aim of digital tools, trying to educate the patient about the disease, will reduce the level of confusion of a patient getting information at the level of the pharmacist, primary care physician, specialist, and then also at tertiary care level, where nowadays patients get different information about the treatment options and what to expect from different treatment options. By digital tools, allowing patients to get access to right information and correct information, we will help the patient to get a better idea about what is available, what are the treatment options, and what portfolio to choose from for every single condition in the respiratory field.
Andrew, that's the journeys that you were talking about.
Yes, no, definitely. And I think something like that would be of great benefit. And can I just pick up, though, briefly just on something that you mentioned about adherence to treatment and how difficult that is. And I agree that is difficult. And so what we need to consider when developing digital tools is the adherence to putting information into something also becomes even harder. If you can't take your medication, why then would you then take time to put information in? But in my response to that, I think if I had something that could map my condition over the course of a 12-month period and tell me, are there trigger points that I've not spotted, because it's very hard for me. I know it's bad in winter, better in summer, but that's all I could tell you. That I would find beneficial. But the other point I'm interested to get people's views on, we so far talked about the patient from a singularity point of view, our patient. I attended an advisory board that EUFOREA organised in February. What was fascinating is actually when the patients came together, and if you said to them, don't collect patient data for yourself, but collect it as a whole so that researchers like yourselves can then go away, study that, see patterns, and create better treatment processes, well, everybody in the room started to go, yeah, I would do that actually, yeah. And we were a very different group of individuals, different ages, different backgrounds, but collectively everybody was bought into that, probably more than logging information on themselves. When you have a condition, you tend to know, if I wake up in the morning and feel very snotty, I don't need to go into my app to kind of like track that. So yes, I'd be interested to kind of get your views on it being used more altruistically almost from a patient perspective, giving back to other patients.
So using the app for research purposes.
Yes, yeah, exactly. And
Well, it's exactly we are revising now the app in order to make it, initially we wanted to have a research app to know if we are doing the right thing or not. Now we have 25,000 users, so we are modifying this, and there are 3 bullet points. The fourth one is this app will help you to better understand the disease globally. Because what you need in your app, it's not that when you have the symptoms, but the week before the symptoms. And you need a warning the week before the symptoms come to tell you increase your medications. But this is not yet feasible due to privacy problems, because you can send anonymized information, but it's impossible to send you back the information to you, or we need some privacy problems which are not easy to solve yet. So, I think what you say is number one. Well, I'm interested to give my data anonymously to improve the disease condition so that I will benefit. This is number one. Number two is that you want an app to inform you that you are going to have the disease, so you need to take your treatment earlier in order to control your disease. This can be done on an individual basis, looking at your data. And then you understand that you have an increase of less or worsening of control, then you are going to get your exacerbation. This can be done with the app. The thing that we cannot do yet, either with my sinusitis coach, I don't know with yours, and with mask air, is that I cannot give you your information for yourself, because this needs a further development in privacy.
Gert, Marion?
Yes, let me give you a concrete example how digital can support integrated care pathways. So essentially, the app is not the solution in itself. It will support the care pathway. So for example, in the apps, we will foresee a personalized treatment plan. It's a kind of a roadmap for the patient that he might go through or not. A different sequence of steps, but personalized to the personalized situation of the patient. So you will get a certain guidance on how to refer yourself to the next step, what kind of treatment to undergo, and how to monitor your symptoms over time. At the same time, digital will support also the physician. The physician will be exposed to a kind of dashboard, and at the dashboard, the doctor will follow up you remotely 24 hours a day. So having said that, the doctor and the nurse will be in a position to monitor you remotely, but also to call you in proactively into the outpatient clinic if they feel a priority for that. So that is how they can bring the right patients to the right treatment, right consultation at the right moment. And that is what integrated care pathways are supported to do, leveraged or supported by digital solutions.
Dr. Usmani, what is the impact of your app on the adherence of patients to that treatment?
So ours is a research app at the moment, and we are in the testing phase. And it resonates very much with what you're saying, Andrew. It maps what's happening to you on a daily basis at the moment. And then a point that Mariёn said, physicians are learning. We are getting information that we never had before. And we are understanding the behaviour of our patients. When patients come to the primary care physician or secondary care, they have particular concerns. Often they're not addressed. They're not addressed because there is a standard template that you have to go through. As you said, we need to rethink the way that we treat patients with rhinitis. And often patients go away maybe frustrated because those concerns have not been addressed. Now, the number one thing in our survey of patients of nearly 200, and we asked them almost 100 odd questions, and we focused it down to 20. The number one question that was answered, or the response, is in terms of what do you want from a digital system. It was not education, it was not personal monitoring of symptoms, it was mapping and trapping my disease so I can show it to a healthcare professional so that they can then guide me on treatment tailored to me. And that is the key thing that we found from our system. And it resonates again with what you've said, Andrew, and what you have described, and what you were saying in terms of how this fits in. So, to be honest, I don't like the term integrated care pathway because I mean, I understand what it means, but it's been developed by doctors, and there are very few ICPs that have actually had patients on board. And what the digital solution is, it is as an adjunct. It supports an ICP, as you say, but it really brings it to address what is happening to you, Anne, or what's happening to you, Andrew. You know, the experienced patient. What do you want, which may be quite different from somebody who's been newly diagnosed, or somebody, as we were just saying, who may require biological therapy or has an issue with adherence to inhaler, and the whole point. So the question is, we are monitoring adherence, we're monitoring the environmental impact, and we're looking at physiology and trying to integrate these three things. And it comes back to the last point that you were making, as a way to predict, in a predictive algorithm, what's happened to you in the last 4 weeks and what may happen to you in the next week. And this is where big data comes in, and it's managing data across borders as well, as you mentioned, Jörn, to develop an algorithm that can predict loss of control. Because I think it's the one thing is your comfort zone is when you're in control, and when you want the early warning sign when things are not going right, so that you can get treatment quickly and effectively.
That's exactly right. But in fact, the two of you have made very interesting comments. You said, I want to know what I have. It's available. You want to know what I will be. It's different, because you want to see, well, I am here, but the other days how was... But you are not interested in the past, you're interested in the future. And by the way, we need to mix the two in the app. The past, we know it. The future, we try to work on that. We're not yet there. So this is very interesting because you found something. We found exactly the same because we had also patient views of our app. And the first thing was, I want to do shared decision making, to share with my physician what I have. This is what you want to do. But you want to do something else. You know that from time to time you have an exacerbation. And this exacerbation, when you get it, it's too late. Then you need to get a big treatment. And what you need to do, to want is that, well, I'm less well than last week. When should I take my next step treatment? And these are two different things. But these are patient-driven, patient-centered approach. And by the way, you said that, and we got exactly the same information with two different systems, because yours is the Rolls-Royce and mine is the Ford T.